Hi everyone, I'm Samantha Miadich. I'm an assistant professor in the Department of Psychology at the University of Massachusetts Lowell. Also, I'm a part of the Applied Psychology and Prevention Science PhD program within the department, and I'm here today to give you a brief overview on my research program. I'm a health psychologist and I focus in on pediatric health. And so we see that a number of children have at least one physical or mental health problem, and that the rates of children that have a problem that affects their everyday lives has risen across the years. And we're also seeing more and more children being diagnosed with multiple chronic conditions, so having more than one physical or mental health problem. And so my program of research focuses in on these pervasive health problems among children, specifically looking at pediatric asthma, sleep problems, and pediatric pain. I also look at health disparities, for example, looking at socioeconomic disparities among children and families and how that impacts the child's health outcomes. I use advanced methodologies and different modeling techniques to try to answer my research questions. And so thinking about my overall program of research, I look at risk factors that impact child health. And so these are things that prevent children from having the optimal health outcomes. And so not only looking at things from kind of this risk lens, I also look at promotive factors. So in terms of what is going to help children reach the best possible health outcomes, right? And so thinking about not only from a risk lens, but from a promotive lens. So what's hindering their health outcomes, what is going to promote their best health outcomes. And then also thinking about a resilience piece. So despite facing numerous risk factors, what are some things that are going to promote the best health among children, right? And thinking about individual differences. And so this is really looking at that for whom question, because we know given associations aren't going to withstand across all children, right? So what children are impacted by this the most? And so this is really getting at a lot of moderation here. And so I look at these things across development, specifically within middle childhood, moving into and throughout adolescence. And so thinking about my program of research, what are some example research questions that I study? And so these are just a few examples of different things that I look at or am interested in looking at. So are higher levels of cumulative risk associated with worse asthma control and quality of life, as well as more emergency department visits among children with asthma? And so cumulative risk, thinking about things like school-related stress, peer pressure, conflict between the caregiver and the adolescent, neighborhood stress, and living in poverty. Does early life parental stress and positive parent personality predict sleep outcomes in middle childhood? So sleep outcomes, thinking of things like sleep duration, sleep efficiency, sleep latency, the timing of the sleep period. And then does positive parent personality buffer the association between parental stress and sleep outcomes? So thinking a little bit here about that moderation piece. Do internalizing symptoms, so things such as anxiety and depressive symptoms, moderate the sleep pain associations among children in middle childhood? So looking at both sleep and pain together among children. Are grip strength and lung function associations driven by genetic and or environmental factors in childhood? And so this is getting a little bit into some questions I do looking with the twin method. So some different things that we can look at in twin studies, thinking about teasing apart those genetic and environmental influences on traits and the covariance between traits. Do caregiver past smoking behaviors moderate the heritability of lung function among children? And so again, overall, my research program focuses on pediatric health problems, including sleep problems, asthma, and pain. And I'm really interested in teasing apart these risk factors, these factors that may promote optimal health, and then looking at that individual differences piece. So I use quite a different number of methods and analyses, such as ecological momentary assessment. I work on twin studies using the twin method, objective assessments, including using actigraphy assessments for sleep, as well as spirometry to assess lung function. In terms of analyses, thinking about multi-level modeling or structural equational modeling. I work with diverse community samples in these studies, and what I'm really hoping to do is inform prevention and intervention efforts. So, thinking about these healthy attributes that can help inform prevention efforts, and then also identifying targets of intervention among groups of children to help um, reach optimal health outcomes for them. So again, this was just a brief overview of my research program here at UMass Lowell in the Department of Psychology. If you have any questions about my research or interested in possibly becoming a part of my research lab, please feel free to reach out and contact